Good evening and welcome to I'm Listening Live. I'm Listening is a 365, 24/7 initiative that works to both destigmatize mental health and also let you know that we are here and we're listening. For those that need some extra resources and support, we'll put some of those up after the show. We got a great show planned for you. I wanted to open by starting off a conversation about anxiety. I think that's something that a lot of us can deal with right now. We want to make sure we know that some of it is contextual. It's part of what's going on around us with the pandemic and also some of our residual feelings from the election. So know that some of it will shift and change as things both open up again and some of these things also start to normalize and settle. Remember, though, that part of anxiety is sometimes just feeling helpless or hopeless. And one of the best ways to really push through that is to take action. So really focus on the things that you do have control over, because there are always factors that we can focus on that make us remember that we do have some power over our circumstances. And also in anxiety, talk it all the way through. Often when we say, what are we most afraid of? We realize that the outcome actually is going to probably not be as bad as we thought it was. And finally, remember that it's okay to get support. Turn to your community and your support, both to find solutions, to know you're also not alone, and to distract yourselves. It's important to take time away from ruminating and overly obsessing about the things that we're worried about. Let's now go to our first guest, Dr. Josh Klapow. How are you? Welcome to the show.
It's good to be here with you, Chris.
How's your mental health doing right now in all the different intersecting things that are happening in our culture?
I guess as good as one could expect. I get asked that question all the time, and we're in some interesting times. And so, yeah, I think I'm doing generally okay as psychologists go.
I like the word okay. It's the best we got right now sometimes. So seasonal affective disorder, for those that are not familiar with that, how do you explain that?
The best way I can describe it is it's depression, like we think of depression, clinical depression, but it's triggered by the change of seasons. And that's something that's hard for people to wrap their head around, because we tend to think about depression, as something that comes on, maybe a big life event or a series of life events that trigger a clinical situation. But with seasonal affective disorder, it is the change of the season and specifically the less daylight that literally triggers a depression, like clinical depression. So we're talking about something different than, just winter blues or the blahs. It is a full-blown mood disorder.
Now, I remember when I was a child, I had a brother that suffered from this, but it never went diagnosed. He never saw a therapist or a mental health professional. And I remember him always struggling, and we didn't know what to make of it. And then I know in his journey, when he found a term for it, he was able to find solutions. So what would be the symptoms that someone would want to look for to help differentiate between, like you said, winter blues versus seasonal affective disorder?
Well, there's definitely some overlap, but you have to think about in terms of severity, the severity and the duration. So things like a sad mood or irritability, difficulty kind of getting out of bed, getting going, kind of slowing, feeling like you're sort of sludging through things, lack of interest in things, problems with concentration, problems with sleep, thoughts that life isn't worth living. Again, these symptoms are going to sound familiar to your listeners because they're the symptoms of depression. And the difference is these symptoms need to be there, 5 or more of them. They need to be there for more than 2 weeks, again, like clinical depression, but they need to have an onset or be triggered by the change in the seasons or change in sort of the daylight and the timing, which is also why we tend to see more seasonal affective disorder in the farther northern states or regions of the country, where it's darker, colder, more intense that way.
Yeah, which is exactly where my family is from. And I think one of the beautiful things is that this is very treatable. And I know that my brother had really positive outcomes by following some of the treatment protocols. So what kinds of treatments are available for people that identifies this?
So there's a couple things. One, a lot of people have heard of the idea of light therapy or phototherapy. So before we even get into things like antidepressant medication or, cognitive behavioral or other sorts of talk therapies, literally exposing the person to certain forms of daylight, either naturally or with like a light box that's prescribed by a physician, can help regulate their physiology such that their mood improves. Now, again, we're not talking about they go from depressed to not depressed, but it absolutely can be helpful. And then if you add in there for some, antidepressant medication, and as well as talk therapy, so that they have the tools to deal with it as it's happening, but also to head some of this off. And I want to be clear about this. Not everybody who suffers from seasonal affective disorder dives into a deep depression every single winter. There's definitely variation in the severity when it comes on and how long it stays.
And I think that's really powerful. When you see the winter coming or the darkness coming, we can kind of prepare ourselves ahead of time. So let's talk about special situations, such as the one we have right now, where we have seasonal affective in the midst of a pandemic, when people are worrying about employment, finances. So what are we looking at when we see the combination of those two?
Well, as I'm sure you've seen as well, the levels right now of depression alone, we won't even talk about anxiety disorders or anything else, just the levels of depression are skyrocketing relative to what we've seen before the pandemic at the same time of the year. So what we're expecting is, number one, we're going to see greater numbers of depression overall, even though seasonal affective disorder, Chris, only represents about 10 to 20% of all depressive episodes are due to seasonal affective. So we're going to see more depression. We're also going to see people who suffer from seasonal affective disorder have a tougher time, because it's not just the triggering by the seasons, it's all the other things going on. That's why I'm a big proponent, even with the light therapy and some of the antidepressant medications, definitely the psychotherapy as well, because you've got to have the tools to cope and to help get yourself through. So we're going to see, kind of as mental health professionals talking about, we're going to see, I wouldn't call it a pandemic, but maybe an epidemic of mental health problems right now.
Man, what a tough year for all of us. Dr. Josh Klapow, thank you so much for being a part of our show.
My pleasure, Chris.
Have a beautiful night.
You too.
And there it is. We've got a lot of different intersecting things happening right now. And it's really important to be able to separate out what is causing what, because that helps us find a solution. So for those that want to learn more, please do your research and contact a therapist and talk about possible solutions, because a lot of them are definitely out there. All right, let's go to our next guest, Dr. Doreen Dodgen-Magee. How are you? Welcome to the show.
Thank you so much. I'm so honored to be here.
How's your mental health doing right now through all the different things that are happening in the world?
It's exhausting, isn't it? I think or at least my stamina feels like it's, flagging at times, but I'm doing what I can to take good care of myself.
That's right. We're doing the best we can. I keep saying, dropping the bar a little bit, 60%, 70%. That's all we got to give right now, right?
Yes, my motto is good enough is both good and enough.
I love that. So let's talk a little bit about technology, which of course is a big topic. Technology is everywhere. What effects are we seeing on our mental health and relationships as a result of the way we're using technology?
Yeah, well, it's really tricky because we are being very benefited by tech. It allows us to be entertained, to be connected, to work, to school, even in this time of physical distancing. But there are some profound negative impacts. We're seeing a lot of kind of an inability to focus, or a decreased ability to focus, and to delay tending to distractions. That's becoming harder and harder. We're getting just overly distracted, and we have access now to our screens all the time. And so we give into that more, which eats away both at our focus and also at a sense of what I call an internal locus of control, which is that ability to come back to center, to calm ourselves down, to keep ourselves from doom scrolling, to find things that actually kind of soothe our bodies and our minds and bring us back to a state of emotional regulation.
Yeah, I start always with myself, and knowing that you were coming on in the topic, I was kind of tracking myself this morning, and anytime I had a moment, quote unquote, free, I would reach for my phone to try to fill that moment. I thought, where's my ability to just be still with myself, right?
Yeah, we have lost it. And I say that if all Americans could commit to 10 minutes a day of being inconvenienced, uncomfortable, and bored, we would undo some of the negative effects we see as a result of our tech use. That simple time, like you're saying, of just sitting and being still, or when we hit a red light, not reaching for our phone and actually taking that time to kind of check in with ourselves or take some deep breaths, these can have a profound impact, even though they're tiny chunks of time.
And let's talk about relationships, because when I'm working with couples doing couples or marital therapy, one of the things I'll talk a lot about is not feeling connected. And so I'll bring up the topic of, are we using technology as like an intimacy buffer? Are you saying hello or engaging while on your laptop or on your phone? So talk to us a little bit about how it can really keep us separated from those we care about.
It does. It really forces us to isolate from the people that we are in physical proximity with. And it forces us to do the work of kind of this multitasking, or what technologists call task switching, which is doing one thing with our screen and also trying to connect with another person at the same time, which we know the research tells us over and over and over that task switching and multitasking, especially in communication and intimate relationships, decreases our sense of satisfaction with both ourselves and the communication we have with our partner, therefore really hurting the connection. So this is another place where just setting our devices down, doing one thing at a time, communicating well, or doing an activity with our partner can have a significant impact on both our relational health and our personal health.
I love the word one thing at a time, because that's what I keep trying to tell people to do. If you want to be on your phone, be on your phone, but put the movie on pause. If you want to watch a movie, put your phone away. And I'm one of those people, and this annoys a lot of individuals because everyone's still trying to multitask. But when someone's talking to me, if they pick up their phone, I always go, I'll wait. And it's not me trying to be rude. It's me trying to say, like, I'm a person, I deserve full attention, right? We want more of that.
It is true. It's really interesting to me that one of the things that technologists and researchers will list as one of the best positive impacts of overuse of technology is that we become better task switchers and better at asynchronous communication, which means having these uncompleted, more shallow conversations while doing other things. And I think that's actually eroding the health of many, many relationships right now.
So you support my boundary setting.
I do. And, we have to own that these devices and apps that are brought to us on them are created with addictive design. So they're created to make it hard for us to set them aside. And they're also created to give us much more kind of dopamine release and even release of certain hormones that can be much more satisfying than sometimes our interpersonal interactions are.
Oh,
so it's
God
going to
bless
take
it.
discipline. I know it's going to take discipline and really hard work, which we have not trained ourselves to have in order to do what will make us healthy.
So in one of the articles you wrote, you referenced something, and I love this term, third quarter phenomenon. And when you went through what that means, I really related to that. So share that with our viewers.
Yeah, so the third quarter phenomenon comes out of research around times when people are in periods of prolonged distress and also socially isolated. So research in submarines or in space travel. And it basically involves things like burnout, like feeling kind of thin around the edges, feeling like we don't have very much insulation, we're more reactive, we're emotionally dysregulated. And I think we are definitely in the third quarter phenomenon of the pandemic. The tricky thing is that in the research we have around this phenomenon, those folks have known when the end date of their experience is, and we do not know the end date. So it means really treating this time of social distancing much more like a marathon than a sprint, and making sure that we are taking breaks as and when we can, especially taking breaks from things like technology that do dysregulate us, and making sure we are tending well to our bodies so that we can maintain the prolonged distress with the lack of normal rewards.
Wow, yeah, that was well said. Not knowing when the end is going to necessarily arrive, and so we have to kind of be in it for a marathon. Dr. Doreen Dodgen-Magee, thank you so much for being a part of our show.
Thank you. Have a really great day.
You too, be well. And I think that's really important. We're trying to remember that we don't necessarily know when all of this is going to be alleviated. And we have to think about our mental health, but also our physical health. They're definitely interconnected. So use technology in service of bolstering your mental health and not using it against relationships where we need that intimacy and that presence and that connection. For those that need some added resources or support, we're going to throw some up after the show. And you can check out past episodes of I'm Listening Live on all of the radio.com handles. As always, y'all, thanks for hanging out with me, and you have a beautiful, beautiful rest of your night.